Hi, it's Dr. Felipe Cabrera Vargas, a vascular surgeon from Bogota, Colombia, Fundación Santa Fe, Bogota. Today we are here with Dr. Maria Diaz, our med student from Universidad de los Andes, Bogota, Colombia too. In our first video of the surgical instruments series from BGS Academy. Today we are going to start with one of the most important surgical instruments, and that is the needle holder. As we can see here, the needle holder has two proximal rings to handle the needle holder, a ratchet system, a body, and a tip where we can put fix the needle to perform surgical suture and surgical stitching in any tissue. The needle holder, we can handle it using two different techniques. One is the palming techniques, using the thenar and the hypothenar region of our hand. This palming technique gives us a lot of versatility to perform backward and forward stitches, as you can see here. Okay, and these palming techniques allow us to the possibility to perform the Cambridge twist in our hands to avoid the suture twist and the possibility of break break the suture during the performing of the surgical knots. So the other technique that we can use is the finger grip. The finger grip gives us the possibility of perform more precise and careful stitches. As we can see here, the first and the fourth finger of the hand are into the rings of the needle holder. The third and the fifth fingers of the hands give us stability to the needle holder, and the index finger, the second finger of the hands, give us precision. So we have a lot of control of the needle and all the body of the needle holder to perform a precise and exact suture. So palming is especially for bigger or more non-soft tissues, and finger grip we recommend it to be used especially for vascular structures or very soft structures that requires more precision and careful when we perform surgical sutures. Then we have to know that how to use it, the needle in the needle holder. We have to remember that the needle must be put in the tip of the needle holder and in the body of the needle, okay, with an angulation of 35 degrees, as we can see here, and only one clip of the ratchet, because if we use all the clips of the ratchet, the useful life of the instrument will be more short, and we can with the time and the abusive use, we can damage the tip of the needle holder. So only one clip of the ratchet, and then we can perform in a 90 degrees attack angle with the needle, perform a suture. Always remember that the movement of the needle holder is a movement in the wrist, a rotation of the wrist, and not a complete movement of the forearm. when we pass the needle, we have to use the pull and push technique to extract the needle from the tissue. So we push the needle and we pull the needle. Always remember to pull the needle not from the tip of the needle, okay? No, we have to grab the needle always from the body of the needle to don't damage the tip of the needle, because if we damage the tip of the needle, we are going to damage the tissue in every next stitch that we perform. So we complete the pull and push technique, and then we perform the Cambridge twist in our hands and complete the preparation of the needle in the needle holder for the next stitch, and continue. So with all these technical tips, we hope that it's going to be useful to your surgical training. Thank you very much to be here, and be ready for the next week for our surgical instrument series from BGS Academy. Thank you very much.